This is the Fertility Friday podcast, episode number 100. Welcome to part one of the 100th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. I started this podcast because I believe that every woman has the right to know exactly how her body and her fertility works. I'm here to connect you with the tools and information that you need to improve your menstrual cycle health and fertility. And I feel so privileged to be able to share my passion for body literacy and fertility awareness with you every single week. Fertility awareness is so much more than just birth control or trying to get pregnant, because it truly gives you a window into your own health and fertility. And I love sharing my expertise with my clients and helping them to understand their charts and connect with their cycles. If you've recently discovered fertility awareness, but you're not feeling confident about using it for birth control just yet, or if you've been charting for a while and you're having trouble making sense of what's happening in your cycle, I can help. Get started today with a free 15-minute consultation with me by heading over to fertilityfriday.com/coaching, or just click the Work With Me button on my website. And I would also like to invite you to sign up for the Fertility Friday newsletter. Head over to fertilityfriday.com/ebook, and as a gift to you, you'll receive a free copy of my new ebook where I reveal what to expect when coming off of hormonal contraceptives, and I share 5 steps to restoring healthy menstrual cycles post-pill. Before I start today's episode, I just want to say how excited I am that I actually reached episode 100. This is a huge milestone for me, and I'm so excited. And so because I was just so excited that I reached episode 100, it's almost my 2-year anniversary, podcasting anniversary, if that's a thing. But I'll in December of this year will be the actual 2-year anniversary. And so I wanted to compile a really special episode for all of my listeners. Some of you have been listening to me for almost 2 years, which is crazy. And I did an audience survey recently, so I know some of you have actually listened to every single episode, which is also crazy. So this is part 1 of my special anniversary show. After compiling all of the clips and going through and organizing them and sorting them out, I realized that I definitely needed to split this episode into 2 parts. So in today's episode, I decided to compile some great clips from the previous 99 episodes that I recorded. And trust me when I say that there's no way I could capture all of my favorite moments in one podcast. But if you happen to be tuning in for the first time, this will definitely give you a great sample of all the topics that I cover in the show and some of the amazing information that we are privy to thanks to the amazing, fabulous guests who have shared their knowledge and experience with us on the show. After 100 episodes, by now I've definitely done at least 100 interviews plus. And one of the biggest takeaways that I have after, like I said, almost 2 years of podcasting and 100 episodes under my belt is how very important and transformational that these topics are for all of you. I can't tell you how many emails I've received from women who've discovered the podcast and, dove in, binge listened to countless episodes and found themselves feeling thankful to have found this information, but also very disappointed and frustrated that it had not been available to them sooner. I think that's one of the most common things that I hear from my listeners, that I hear from you, which is, I wish I would have found you sooner. Oh my goodness, I wish I would have found your podcast 20 years ago. And I feel so honored to be able to share this information with you, and I certainly don't take it lightly. I do appreciate all of you for tuning in every week, for leaving countless amazing reviews on iTunes. It's really humbling when I go in there. I don't even know how many there are, but thank you so much. You guys have been amazing, and it's definitely made a huge difference, expanded the reach of my show. So for all of you who subscribe to the show, who tune in and listen to the show, who write reviews on iTunes and share the show with your friends, whether you share it on social media or whether you just, go on your phone, and you can actually do that. You can actually, if you're on your phone or in your iTunes, you can actually share an episode with a friend. So for all of you who've done that, I really do appreciate it, because it makes a difference, and I can see the difference in the downloads. I can see the difference in just the activity and the number of emails that I get. So all of these things that you're all doing are amazing. I really appreciate it. And, I'm just so honored to be able to do this and to be able to share this information with you. And so if this is your first time listening, then I do encourage you to subscribe, to go ahead and leave an iTunes review if this show has meant something to you, if it has touched you in some way or made a difference in your life. I would really appreciate that. That's one of the ways that helps the show to be searchable in iTunes, because iTunes is a search engine. And so all of the reviews, all of the sharing, all of that really helps. And of course, I want to say a special thank you to all of my guests who have come on the show. I wouldn't have a show without all of you listening, and I certainly wouldn't have a show without all of my amazing guests who have taken time out of their busy schedules to share their knowledge and wisdom with us on the show. And so, without further ado, I'm just going to jump into the episode, and just in my typical fashion, I could barely narrow it down. I'm pretty sure that the total number of clips that I'm going to share with you today is like over 30. But either way, I wanted to share with you some of the clips that touched me, some of the clips that have stuck with me. Some of them I've mentioned on the show numerous times. And, there's a lot of really fantastic guidance and wisdom. I could absolutely not capture the essence. Well, I can capture the essence of the show in one episode, but I absolutely cannot capture all of my favorite moments or all of the interviews that I've done. So I've done my best. And if you're listening and you are a past guest and you find that your episode isn't in here, please don't think that that means that I didn't love our interview and that there wasn't a ton of tidbits. But if I had really done that type of compilation, I think this episode would have been like 8 hours long, and there would have been countless clips from every episode. So I really hope you enjoy this. This is the first time I'm doing this. It was a lot of work, and so this is the masterpiece. Okay, so the first clip that I'm going to share with you is from the wonderful Toni Weschler. And I mean, without her book, Taking Charge of Your Fertility, many of you wouldn't even be listening. I don't even know if I would be podcasting, because her book was my entrance into the fertility awareness method. And so, Toni's book is where it all started for me. It was such an honor to be able to have her on the show and to actually interview her and pick her brain, from the source. It was just a really great moment for me as a podcaster. And just, after all the years of being influenced by her book, to actually be able to speak to her directly and ask her about how she discovered fertility awareness. So one of the things that I really liked about the interview with Toni was that she shared how she discovered fertility awareness, and it was a really funny story. So I'm going to let Toni tell you how she discovered fertility awareness and what led her to write Taking Charge of Your Fertility in this clip.
Well, as some of you probably read in the intro of my book, my actual introduction to fertility awareness itself was through a really humiliating experience, and maybe some of you read it. What I did was kind of a very unusual route to learn about fertility awareness. I worked out in some avocado fields on a kibbutz in Israel years ago, like maybe 30 years ago or so. I was working out at like 4 a.m. or so. I would drive out on this very bumpy tractor, and I would work in the avocado fields on the kibbutz. And one day when I was out there, I just had this epiphany, and I have no idea where it came from, but I had just decided. I had already graduated from college, and I had just decided that I wanted to do something with women's health, and I have no idea where it came from. So I'm out there digging around the roots in the avocado fields in the blazing sun, and this is where I got my epiphany. So the humiliation comes in when I returned back from my year on the kibbutz and proceeded to go to a women's clinic, because I noticed that this wasn't well before the internet. This was in the days before the internet. And I noticed that they had an ad for a women's health educator. And I naively thought, oh, I love everything to do with women's health. I'm just going to apply to be a women's health educator. So I arrived at this clinic feeling pretty confident about myself that, all I needed to do was just have a love of women's health, and that would be it. All would be good to go. I'd be in. And while I'm sitting there, as I'm kind of glancing around at all the various paraphernalia in the clinic, I noticed that there is a brochure on the coffee table in front of me that is something about the fertility awareness method. And I pick it up, and I'm struck with this sense of doom, because my reaction was, oh my God, I'm about to apply to a women's clinic that teaches the rhythm method. Oh no, what do I do? Do I say something? Do I keep my mouth shut? Do I risk that maybe I would alienate them if I say something about, why are you teaching the rhythm method, or do I, open my mouth, and what do I do? So I decided, I had to speak the truth. And when the executive director called my name to come in for my interview, I walked in, just feeling this sense of anxiety, like, oh God, what do I do? And before I even sat down, I blurted out something to the effect that I was really surprised that they taught the rhythm method at this clinic, because I had known it to be a very reputable clinic, and what were they doing teaching the rhythm method? And no sooner had I blurted that out that the director looked at me with this look of kind of disdain and said, wait, we teach what? And I, kind of meekly said, we teach the rhythm method, right? I mean, here's the brochure. Don't you teach the rhythm method here? I mean, everybody knows the rhythm method doesn't work. And she looked at me with these really kind of annoyed eyes and said, Miss, what is your name? Weschler. Yes, Miss Weschler. I think it probably wouldn't bode well for us to have a women's health educator that doesn't even know the difference between fertility awareness and the rhythm method.
Wow.
Yeah, that's what I said. That is what I said. I felt the blood just drain from my head. I was so embarrassed, and she basically shook my hand and said, thank you for coming in. And I just basically went out with my tail between my legs, got in my car, and started sobbing. I was so humiliated. But I got home, and I read that brochure over and over, and I thought, well, if this isn't the rhythm method, then what is this? So now I come to my second dilemma. The first was, do I say something or not? The second dilemma is, how do I go back now and take their class and kind of sneak in there incognito so I don't run into this executive director again? Because now my curiosity is really piqued, and at the same time, I've humiliated myself so much I don't want to see her again. But a few days later, I did go back, and luckily the director wasn't there. And I took the class, and I think that I speak for probably every single woman who's ever been exposed to fertility awareness when I say that class just changed my life. Mm-hmm. And that basically is how I myself learned about fertility awareness. And after that, I went back, decided this was going to be my life's work, and I went back and got my master's degree in public health at UCLA. And I guess the rest is history.
What a great story. I just love finding out how it all started with taking charge of your fertility. I get so many questions from both my listeners and clients about how to manage coming off hormonal contraceptives. And in this second clip that I'm going to share from my interview with Tony, and so for those of you who want to go back and listen to these episodes, let me just note here that I will have a list of every single clip, and I'll have them in order to on the show notes page. So you don't have to worry about remembering all of them. I'm just going to have a list. Like I said, it's going to be 35 or so clips that I've compiled, but they're all going to be listed there. But Tony's episode is number 44. And in the second clip from her interview, I'm just going to share Tony's take on what's happening in the body after a woman goes off of hormonal contraceptives, and particularly why a woman's cycle will go from being quote unquote regular when she's on the pill, and then it'll turn into a more quote unquote irregular cycle when she comes off. And she also shares her advice for managing fertility as your body transitions. For a woman who's listening and she's on some sort of hormonal contraceptive method of birth control, she doesn't want to get pregnant right away, but she is thinking about trying for a baby maybe within the next 2 to 3 years. What advice, if any, would you give to her?
What advice would I give her?
Yeah.
When you first come off of any type of hormone, your cycles are going to be a little tricky, and so you need to be extra vigilant if you are planning on avoiding pregnancy, because it's a little harder. When you first come off of any type of hormonal method, your body's going to take a while to get back into its normal hormones. And one of the things that's just so surprising to me is how many women, when they go off, let's say, the pill, I'm always amazed at how many women will say, I just don't understand. When I was on the pill, my cycles were so regular, and now it's like they're all over the map. And I feel like, wow, they really didn't get it, that they were on an artificial hormone that was making them have quote-unquote periods. Those were not periods at all. That was withdrawal bleeding, and it was the withdrawal of the pill that caused them to bleed. So women that are coming off and then want to get pregnant in a couple years, ironically, they're the ones that have to be extra careful, because it may take a few months for their cycles to return to normal. So during that time, before they can really use it as a method of birth control, they need to be extra vigilant, because otherwise they could have a surprise unplanned pregnancy if they're not prepared for the fact that their cycles may be a little wonky for a while until they settle into normal hormonal cycles.
So the next couple of clips that I'm going to share with you are from an episode that I recorded with Laura Bryden. And this was the first episode that we recorded together. It was actually one of the first episodes that I recorded. It's episode number 7. And this is an episode that I've referred to in so many of my podcast episodes over the past almost 2 years. And, in this episode, Laura shares her view on hormonal contraceptives and paints a very clear and succinct picture of what the pill really does to a woman's hormones. So if you're new to the Fertility Friday podcast and you haven't dug into all of the episodes, like all of the archives, definitely take a listen to episode number 7, because it was really, really powerful interview. And so I'll let Laura explain to you how the pill affects a woman's hormones in the next clip. What would you say in your practice are some of the biggest myths around hormonal health that you kind of encounter regularly?
Yeah, interesting question. Well, I'll say hands down, the biggest one is that, and this probably won't be a surprise to you or your listeners, but the biggest myth is that the pill somehow balances hormones, when in fact, of course, it's the complete opposite. So I think that myth has been a crime against women. The amount of sort of confusion generated by that is something that I've spent a career, kind of a lifetime, trying to counteract. Certainly a truth is that diet and lifestyle have a huge impact on female hormones and period health. And, I guess a myth might be sort of, the conventional doctor's view that doesn't make a difference. When in fact, diet's probably one of the biggest things to do.
I think that myth drives women's choices, because it seems like the pill is the catch-all solution for anything related to hormonal imbalance. So maybe if you wanted to talk a little bit about what the pill actually does in the body, so that maybe the listeners can have an idea of why it doesn't actually balance hormones.
Yeah, excellent question. All right, Lisa, what it does, essentially what it's meant to do, and what it does is it switches off hormones completely. It shuts down the ovaries temporarily, although I'm sure from women's experiences, and certainly I know from my patients, that sometimes that effect is less temporary than we'd like. Sometimes it can take women a long time to get their ovaries back in action after stopping the pill. I'm going to use a strong word here. I don't know if this is okay with you and your audience. I feel like, the pill is a form of castration. It's a chemical castration. It's it's in that sense, and I don't use it lightly. It shuts down hormones. It shuts down libido. It affects mood. It affects, hormonal vitality and health in the same way that castration would affect men, essentially. And I don't understand how women have put up with it for so long.
In my interview with Laura, I remember asking her what are the most common side effects of the pill. And, to be honest with you, I thought she was going to say something like blood clotting or stroke or, water retention or breast tenderness or something like that based on my, understanding of the pill at that time. But the side effects that she outlined are much more disturbing. And they've come up numerous times in interviews that I've done over the past 99 episodes. So here's what she said. What are some of the side effects of the pill?
Depression. And this is a controversial one, but I would say it's only controversial because there's been such, a tragic lack of study on the issue that any doctor really who works with women and looks at this and takes it half seriously knows that it increases the risk for depression and anxiety. Not to say that every woman that takes the pill will develop that, but it's pretty common. And the other thing that happens is many women start taking it so young before they really kind of even realize, sort of have a sense of who they are themselves. And if depression comes on as a teenager, do you really then think, oh, that's because of the pill? You just think maybe it's just because, you're developing into a person. So mood is the one that makes me the most sad. The second one that makes, in terms of my sadness about the issue, is loss of libido. And I know this is true. I've started actively asking my patients about it a bit more actively recently because I'm just really wanting to get a sense. And I think it's almost universal. Of course, there are going to be exceptions. Some women who don't notice a drop in libido or sex drive, but it's very common. And again, it's probably something that women might not realize has even happened because they started so young at 14, 15, before they've even really had a chance to learn what their own sex drive is like. There are some people maybe who will insist that it was okay for them, but almost all women notice something in drop in libido, which is not surprising considering what the drug is doing to hormones, as we discussed earlier.
Mm-hmm. Well, I think it's really interesting that the first thing that came to mind was depression as a side effect, and then loss of libido, because, we hear a lot about the issues regarding stroke, blood clotting,
yes,
22-year-olds having stroke, that type of thing. And it wouldn't necessarily be the first thing I would think that depression would be associated with pill usage. That's really interesting.
Yeah. Yes.
The next interview that I'm going to share a few clips with you from is the interview that I did with Dr. Jerry Lynn Pryor. So this is episode number 55, and it's one of the episodes that has been, talked about the most, I would say. In my interview with Jerry Lynn Pryor, she talks about her research in the area of menstrual cycle health and the important role that regular ovulation plays, not only in fertility and menstrual cycle health, but also heart health, bone health, and breast health. I was so excited to have the opportunity to talk to Dr. Pryor about her work because it really gets at one of the most important ideas that I've been exploring on the podcast, and one of the reasons that I started the podcast in the first place. And that is that a woman's menstrual cycle plays an important role in her overall health. And when a woman's menstrual cycle is unhealthy, it's actually telling her that something is off with her health. In this clip, Dr. Pryor describes how it is possible for a woman to have quote unquote regular cycles and not be ovulating regularly. She also describes how it's possible to be ovulating, but still not have sufficient levels of progesterone. So when you listen to this clip, you can actually hear my very new baby, Malcolm, because he joined us for the first part of the interview. I was actually breastfeeding him at the beginning, and then at some point I, passed him to my mom because she was staying with us for a little while. And so yeah, when I was preparing everything and when I was preparing all the clips and I was listening to it, I was just like, "Aw." And he just turned 1. So now it's fully a year later. So I'll roll the clip and you can hear Dr. Pryor's thoughts on this topic. One of the topics that you've written about recently is kind of that myth that if a woman is having a regular menstrual period, if her cycles are quote unquote regular, whatever that means, I know I challenged that concept a bit on the show, but that it means that she's ovulating regularly. And so some of the work that you've done has challenged that idea. So did you want to talk a little bit about that?
Yes, let's talk about that, because the assumption is, and most of us as women are taught it, that if we have a regular cycle, we can ignore it, everything's fine, no worries, carry on with your life. But the concerning thing is that there can be silent ovulatory disturbances. In other words, a regular cycle does tell us something important, and that is we have enough estrogen. But it doesn't tell us that we have enough progesterone. And the notion that every cycle is ovulatory if it's of a normal length, the so-called normal length, I'm putting quotes in the air here, is 21 to 35 days. Mm-hmm. And if you can predict, in other words, it's less variable than a week different in length from cycle to cycle. But I learned a long time ago that cycles are very variable in the amount of progesterone or post-ovulatory or luteal phase length. So a regular cycle can be normally ovulatory with a normal luteal phase length, which by the quantitative basal temperature method that I use is 10 days or more. If you're figuring it from the LH peak in the urine, a urine fertility test, then 12 days is the essential normal length of the luteal phase. But a regular cycle can also have ovulation, but a short luteal phase, less than 10 days, which means that you made an egg, but you're not likely to be able to become pregnant and carry that to term, in part because the lining of the uterus needs more progesterone before the fertilized egg can implant. Mm-hmm. And then finally, and most intense of all, is a regular cycle can just have no ovulation at all. So I had found that in a group of women who were generally lean and who were proven ovulatory, normally ovulatory initially, that very few, like 13 out of 66 women during that year, had some disturbance of ovulation. And yet less than 1% had any abnormal cycle lengths. So I knew that ovulation was highly variable, but it simply wasn't reflected in most of what women could find out about or in the medical literature.
Such important information. And unless a woman's charting her cycle, I'm not sure how she would know if her luteal phase was shortened or even if she would have those other advanced indications that her progesterone levels might be low. And I wanted to share a second clip from my interview with Dr. Pryor. And in this clip, she explains the connection between the menstrual cycle, more specifically ovulation and progesterone, but the connection between ovulation, progesterone, and bone density. She also talks about the impact of beginning to take hormonal birth control before a woman's cycle and her bones are fully developed and matured.
The few studies that we have that have studied women in their sort of mid-reproductive lives, let's say from 25 to 35 or so, the pill doesn't seem to change bone at all. It seems to be neither good nor bad. So that's good. Mm-hmm. But and this is new, it hasn't hit the consciousness of the general public yet, is that if a woman starts the pill when she's still growing bone, when she's a teenager, that there may be negative effects on her bone density. And that is super important because the way bone works is we build a strong skeleton and achieve a peak bone mass. Some for the hip sites, it's in our late teens. For the spine, it's later in our 20s or 30s. And that's as much bone as we'll ever have. The rest of our life, we either hold it steady or we begin losing it. So it's important to build a strong peak bone mass. And I think that young women who use the pill especially if they use it before they've established normal ovulation, may have difficulty achieving a normal peak bone mass and may be at risk for osteoporosis later.
Well, how long does it take then for a young woman's menstrual cycle to develop and mature? So obviously this is going to be different, person to person, but
right.
From your experience and from your research, about what age does a woman reach that peak bone density or bone mass?
Well, the peak for bone in the hip is in the late teens. The peak for the spine is in the 30s. But the menstrual cycle, the maturation of the normal menstrual cycle takes on average about 10 years, maybe 12 years after the first period, after menarche.
Okay, well, that has significant implications because most women who take hormonal birth control, it's safe to say that they're taking it before they're 30. And you mentioned that that's when our spinal
that's right.
column is at peak bone density. And
yep.
Many are taking it in their teens, which is also before the hip peak formation. So
that's right.
That's a scary thought.
It is. And increasingly, I think that birth control pill is being used for treatment in the teen years. What we're seeing is that the average age at starting the pill in those who are in their teens still is like 16 and a half. If they're 20 to 24, the average age is like 18. But in the adult cohort that was somewhat earlier, the average age at starting was almost 20. So we seem to be using the pill at younger and younger ages. And in the teen years, more than half, according to the CAMOS data, are using the pill for treatment, of something like cramps or irregular periods or skipped periods or heavy flow or acne.
The important takeaway from this interview is that regular ovulation is a critically important and necessary event. If a woman isn't ovulating, that means she isn't producing progesterone. And as this episode reveals, progesterone is important for way more than your menstrual cycle. Having enough progesterone is important for bone health, heart health, and breast health. And in this last clip from my interview with Dr. Pryor, she explains the different roles that estrogen and progesterone play in the body and the relationship between having too much estrogen in the body and breast cancer.
Estrogen's job, whenever it sits on receptors where whatever tissue it's in, is to make that tissue grow. And proliferation, if it's unchecked, is one of the risk factors for breast cancer. But progesterone's job, after a short time of initial growth, is to make that tissue more mature, more grown up, which is against breast cancer risk. So if you have enough progesterone to counterbalance the growth effects of estrogen, then breast, like other tissue, is not at risk. But if you don't, then there may be some overgrowth that eventually leads to malignancy.
So the next few clips I'm going to share with you are from the interview that I did with my guest, Joy DeFelice. And this was episode number 53. And in this episode, we talked about the effect of light on the menstrual cycle. And, in my next clip, Joy shares what would seem like a solution that's way too simple to actually have a significant impact on the menstrual cycle. So for those of you that haven't listened to this episode, it's definitely one to listen to. This would be kind of the quote unquote simplest and say cheapest, like freest the thing that you could do that could make such a significant, substantial impact on your menstrual cycle. Joy wrote a book called Effect of Night Lighting and the Menstrual Cycle. And in her research, she found that when women don't sleep in complete darkness, it interferes with her hormonal cycle and her menstrual cycle. For many women, simply changing their sleep environment and making sure that they're sleeping in total darkness is enough on its own to improve their cervical mucus production, lengthen their luteal phase, and even prevent miscarriage. there's a direct correlation between the light that comes into your bedroom at nighttime and the amount of progesterone that you produce, the amount of melatonin that you produce. And so in this clip, I'll let Joy talk about that a little bit more.
Now we can stay up later at night than before. In generations past, people had to go to bed when it got dark, or they stayed up in much dimmer light than what we have now. But again, as you and all your listeners realize, you can stay up till the wee hours of the morning now and be in light a much longer length of time. So between the increase of light sources and being able to be within those light sources for a longer length of time, women don't get an authentic nighttime anymore. They have light within their sleeping area or around their sleeping area, reflecting in from the outside or other rooms in their home, perhaps. So they really, as I mentioned, just don't get an authentic nighttime. And that affects the women's hormones because the light messages that are present during the woman's major sleep period, which for most women is during the night, but it can be during the day for night workers, of course. Even though a woman is sound asleep, those light and dark messages are picked up even through her closed eyelids by the optic or eye nerve. Mm-hmm. Just like if you try to close your eyes now and said, oh, I'm going to close my eyes, it'll be dark. You can tell just in a second that, no, it's not dark there. There's light messages coming through your closed eyelids. So this happens at night, too. So no matter how much light is in the woman's environment, that is picked up by one section of the optic or eye nerve, and it's relayed to the pineal gland in the brain, and that's where melatonin is produced. And that amount is dependent on those light and dark messages that the woman is receiving throughout the night. And the reason that's important is the melatonin hormone is supposed to be high at night and low during the day. But if light is present at night, of course, then it affects that normal level of melatonin. And the melatonin has some influence on the hypothalamus gland in the brain, and that's where the woman cycles from. Her reproductive hormones cycle from her brain, not from her reproductive organs. And so the physiological impact of light and or dark messages in the environment subsequently affect the hormonal output from the brain back and forth to the ovary, of course. And the woman can see this in her charting very easily, and you can see the positive differences when the light sources are eliminated and she can be in an authentic nighttime.
Joy's research in this area is so interesting, and I've received emails from listeners who, after listening to this episode and changing their sleep environment, it's just having a dramatic impact on their menstrual cycle charting. And I mean, your situation might be more complex. It's not to say that every single woman, all she has to do is sleep in darkness and all of a sudden her cycles are going to be perfect. But for many women, just changing the sleep environment is enough to make a dramatic improvement in certain areas. And so this is definitely one of the big items that you'll want to rule out, especially if you have a short luteal phase, if you are showing limited mucus production, cervical mucus production, or continuous mucus, if you have some sort of mucus all the time, or even if you've been experiencing recurrent miscarriage. It's one of the things that you want to rule out because, like I said, it seems too simple to actually make that big of a difference, but can have this massive impact on your cycle. So in the next clip that I'm going to share with you, it's an interview that I did with Rachel Eyre, and she is a UK-based fertility awareness educator. So this was from episode number 67. And what I loved about this, this episode was great. It was a lot of fun to talk to her. And one of the things that I loved about the episode is her description of the dancing fallopian tubes. And since we're not taught much about our bodies and our reproductive systems, we typically don't have a good idea of what the heck is going on down there. And in my work with clients and in my work with my group program, one of the things that I do a lot of is just the basic education of our reproductive organs and to get us really thinking about what's happening. And so one of the great things that I love about her explanation of the fallopian tubes and, how they move around within the body is that we don't really picture our organs, and we don't really think of our uterus and our fallopian tubes as kind of moving around because we don't really have a frame of reference of what these organs are physically like. And so we typically don't think about them at all. But if we do think about our reproductive organs, we certainly don't think about them as being mobile, kind of having that bit of flexibility within the body. So here's a short clip from that interview.
Has anyone ever spoken to you about dancing fallopian tubes?
Not specifically.
No, so your fallopian tubes, they're usually slightly behind the uterus, but they should be able to move around freely if there's no congestion or adhesions there stopping them from doing so. So if you've only got, say, for example, your left ovary working, but no fallopian tube going there, if there is no constriction, the right fallopian tube can move across and receive the egg and move back into place.
What? I didn't know that. That's insane.
Isn't it amazing what your body can do?
Okay, so I think I just need to sit with that for a second. So what you're saying is that the uterus can actually, because I know one of the things, so for the listeners who might not be so familiar with the anatomy and physiology, so the fallopian tubes are not connected to the ovaries. So no, that I know.
System.
And so when a woman ovulates, the egg is released into her abdominal cavity, and then the fallopian tubes draw the egg into it through Mother Nature's brilliance. So I don't know. but that's a thing. And so I think that's an important base for this conversation because the ovary and the fallopian tubes are not connected. So yeah. But I didn't know that. So if the uterus has free a movement and ability, then that's something that can actually happen.
Yes.
Wow.
It's pretty astonishing.
So how did you learn that? Where did that knowledge come from? Because now I'm fascinated.
That came from the fertility massage therapy training. And I have had 2 ladies conceive who have the egg and the ovary and the fallopian tube on opposite sides.
Oh, wow. And that's just something, again, in Mother Nature's brilliance, why we have 2 fallopian tubes, why we have 2 ovaries. And yeah, wow. Okay.
But again, only if there's no constriction in the pelvic cavity.
Wow. So then to kind of summarize what we've been talking about, because this is fascinating. So if a woman has adhesions, and those can be caused by a number of things, so it can be caused or if, related to endometriosis, and I'm sure if there's been any types of trauma, I'm guessing, or
any kind of scar tissue in that area. Even just being in the same position every day can, in some women, cause them to form.
And a lot of us sit, and they're saying sitting is the new smoking. So there's all kinds of, Marie Whitman spoke about that when we did our episode together about movement for fertility. And she talked about how big of an impact sitting all day makes and how important movement is, just to make sure your body's in alignment. So I think that's interesting that adhesions can form because of inactivity.
Yeah.
And so those adhesions prevent the free movement of the uterus, which then impairs the uterus's ability to function optimally, because the uterus is not just this stagnant organ. the most I've learned about the uterus and the muscle, I'm sure that you learned way more than I ever did. But, when I was preparing for pregnancy, I took a hypnobirthing class. And so if anyone has ever, if anyone's interested, the hypnobirthing comes with a book. So there's a book called Hypnobirthing, and in it, they talk about the uterus. And so it was the most detail that I've read about the muscles and the different layers of muscles in the uterus. So you really get a sense that the uterus is like a really heavy duty muscle. And there's all these layers to it. And so it's a very dynamic organ.
Yeah, there's actually 4 ligaments on either side that a lot of people forget about, and 2 holding the ovary in place. So there's a lot of tissue there that can potentially get sort of knotted a bit like muscles get knots in, if you think of it in a similar perspective.
And so then talk a little bit about fertility massage then, what you do, how you can identify where the issues are, and then how it helps to release the adhesions and to improve the mobility of the uterus and everything.
To be honest with you, a lot of the identifying what's going on, you can ask what sort of signs and symptoms people get throughout their bleed. And before you ask me what's the sign of something in line, so someone who's healthy should have a sort of 26 to 35 day cycle. Their bleed should be between 3 and 7 days, and it should be bright red and relatively clear, maybe a few little clots in it. But when people start saying, I have period pain, I have PMS, I have menstrual migraines, I have pain down the backs of my legs, I have changes in bowel movements, I have the increased need to urinate, or a dragging sensation, all these just before and during the first few days of their bleed. First of all, that's not normal. There's lots that can be done about it. And it does frustrate me that all these women are told, it's completely normal. We'll put you on painkillers, just put it on a pill. And it's not actually correcting the underlying condition. If they want to be on painkillers and the pill and other medication, fine. But there are plenty of things that can be done to actually help with that. And when we do the massage, it's not overly prescriptive, as in if someone has this symptom, you do that. We still work on the ligaments holding the womb in place on either side and just getting some more space in the womb, and also working on the abdominal area so that the blood vessels feeding into that area are free and not constricted at all.
What I loved about that clip that we just played is that she delves into fertility massage and the impact that it can have on menstrual pain, abdominal bleeding, and so many other areas. And this has been one of the most fascinating areas for me that I've delved into throughout the past 99 episodes. And so naturally, the next clip that I'm going to play for you is a clip from my interview with Dr. Rosita Arvigo. I discovered Arvigo therapy first through some articles that were circulating around the internet about vaginal steaming. And having never heard of it before, I initially thought, what? Now we have to steam clean our vaginas? Like, I just didn't have the knowledge around it. And after my interview with Dr. Rosita Arvigo, I was completely amazed by the power of the Arvigo techniques to positively impact a woman's reproductive health, and specifically her menstrual cycle health and her fertility. And this gets at, exactly that same concept that Rachel was talking about in our interview, which is to actually physically manipulate the uterus to improve circulation, to ensure proper alignment. And it just goes so much deeper than that. So if you haven't listened to episode number 18, so this is back in the archives, the one that I did with Dr. Rosita Arvigo, and you've ever had painful menstruation, heavy bleeding or clotting, or if you have endometriosis or fibroids, you definitely should listen to this episode, because it can give you a different perspective, one that perhaps you've never been on the radar. The idea that there could be an actual physical limitation, and if corrected, it could just allow your uterus to function properly. So here goes.
The female uterus is one aspect of the benefits of the abdominal therapy. Our therapy goes from the stomach all the way down to the pelvic floor. So it also is a great boon for digestive problems. But because the female uterus is kind of slung like a hammock in the pelvic floor, held in place by 12 different ligaments in 6 pairs each. And because it swings, it's meant to be movable, it's meant to be able to grow every cycle, and then, of course, grow large enough to hold a complete human being in there. So the uterus tends to naturally come out of its proper position. So that could be going downward into the vagina. It could be leaning to the right, leaning to the left. It could be abnormally leaning on top of the bladder, and it could also be leaning backwards against the colon. So what we do is simply massage externally. There's no invasive aspect of our therapy, and we can palpate with our hands the position of the uterus, and the technique is very simple to learn. And then our favorite part is the self-care that women take home with them after a session with the practitioner. And we request that our clients all do self-care at home, simply because the uterus is daily subject to stresses and strains on the ligament that may pull it out of position from day to day. So doing self-care regularly is the best guarantee to keep the uterus in proper position. Now, a uterus in proper position is a fertile uterus. It's a uterus that menstruates painlessly. It's a uterus and ovary that ovulate regularly and painlessly. So we see that function is normalized. When function is normal, there should be no pain, no discomfort, and there should be fertility that is abundant and easy to access for everybody.
In this next clip, Dr. Arvigo talks about how Arvigo therapy is used to improve fertility.
Okay, well, as you know, every woman is a unique puzzle with fertility. There are no simple and straightforward answers. However, we do find in clinical practice that probably 5, maybe 7 out of 10 women with a fertility challenge actually have a misplaced uterus. So that sometimes the uterus is lying right on top of the ovary, and the ovary is not able to ovulate properly, or it ovulates and the egg is not able to find its way into the fallopian tube. Sometimes the fallopian tube is kinked, and all it needs is a good stretch, nice, soft, and easy pull to put it back into prime condition. And of course, a uterus that is lying anterior or backwards or too low also is not cleaning itself out properly. So usually we find women with fertility challenges also have dysmenorrhea or painful periods. And there then comes in place the vaginal steam. Part of our therapy is to recommend vaginal steaming, because the vaginal steam, although we call it vaginal steam, it really doesn't have a whole lot to do with the vagina. The purpose is to bring the steam and the essential oils of the plants into the cervix and into the uterine body itself by means of cleansing. So back again, a uterus in malposition is very likely to have difficulty with normal menstruation. Once we bring it into proper position, recommend a vaginal steam, and if the woman is willing to do self-care regularly at home, we find that the 9 out of 10 women with dysmenorrhea will improve with the abdominal therapy. How many will be able to resolve a fertility challenge? It's really difficult to put an exact number on it, but it looks like after 45 years of experience, about half of women with fertility challenges really need a good, deep abdominal therapy to bring the uterus, the fallopian tube, the ovaries, the broad ligament, the uterosacral ligament, bring them all into proper position to allow a good amount of arterial supply, which brings all the life and the nutrients into the uterus, and to drain away the venous blood, and then also to help with the lymphatic congestion, to bring that to a normal state. And therefore, what you have is a return of homeostasis. Homeostasis simply means balance within. It's normal for women to reproduce. It would be abnormal for a woman not to be able to get pregnant. So when we are able to accomplish these things, then nature, homeostasis, is then put back into proper order and condition, and things normalize, function returns.
And so as you can see, in my interview with Dr. Arvigo, you really get a sense of how important a role the actual physical state of your uterus plays in your fertility and healthy menstruation. And so in this last clip I'll play from our interview, Dr. Arvigo describes vaginal steaming from start to finish, and it really paints a picture of what it looks like to kind of demystify it, because it sounds a little strange if you've never heard of it before. And of course, lots and lots of questions come up, but in some parts of the world, it's completely normal and common and, practiced all the time. So I'll let Dr. Arvigo talk to you a little bit more about vaginal steaming.
Okay, so a vaginal steam, remember, the goal is to cleanse the uterus. It's called a uterine lavage. Lavage comes from the Latin word lavar, meaning to wash or to cleanse. So we use a pot of water to which we could add many different types of aromatic herbs with essential oils. In Central America, the favorite would be oregano, the same oregano that's in your kitchen cabinet, basil, marigold, rosemary. Any one of those four, or any 2, 3, or 4 in combination. So you need a quart and a half of water and 1 cup of fresh herbs, or 3 tablespoons of dry herbs. You bring the water to a boil. Put the herbs in the water, cover it, and let it simmer slowly for 10 minutes. In the meantime, you need to prepare yourself a chair. The chair should have slats in it so that steam can come through. Lawn chair would be fine. Some people are able to put the pot right into the toilet bowl, set it in. You can't pour the water in the toilet bowl because then it just flushes away. But if your pot fits comfortably in the toilet bowl, then you can do that. Otherwise, you sit on a chair that is open at the seat, remove all your clothing from the waist down, keep some warm socks on your feet, get a blanket, and you bring the steaming herbs from the stove, put it under the chair, cover yourself all around from the waist down with the blanket, keep your feet warm, that's very important, and then you sit on that steam for 20 minutes. Now, the caveat is you can't get burned. So if it's feeling really uncomfortable, you pull the pot out, wait about 10 seconds, and push it back in. It should feel really, really comfortable, warm, and soothing. In about 5 minutes, you can taste the herbs on your tongue. So the benefit is that the steam, the heat, and the essential oils enter right into the vagina, through the cervix, into the uterus, and kind of act like Brillo, if you will, on a pot or a stove. If you think of oven off, what happens after you spray oven off in a stove, and you see all that gunk and slime coming down, that's exactly what happens to the uterine membrane if it is indurated, or if it has a great deal of debris stuck to the uterine membrane. The steam, the heat, and the essential oils are able to loosen that material. Then on the next menstrual cycle, and we like to do the vaginal steams as close to a menstrual cycle as is possible. So it should be the day before or 3 times in the week before menses is about to begin. Then it's always important to tell a woman that there are definitely going to be changes in her menstruation. She is going to see what looks like coffee grounds. She might see what looks like chocolate syrup. Sometimes it clots. Sometimes it looks like hamburger meat coming out. But as we always say, better an empty apartment than a bad tenant. And so the woman has to be prepared that there might be more menstrual flow and that there is very likely to be a flow that looks very different. Let us just say that. Usually 1 week of vaginal steam is enough for a woman to cleanse the uterus. Sometimes, based on the report that she gives us after the vaginal steam, we might recommend another month. Then we think that there is a maintenance a schedule as well, where a woman should really, no matter if there are no pathologies, in order to prevent pathology, a vaginal steam is ideally done 4 to 6 times in a year. If there are pathologies, we think it should be done previous to every menstrual cycle until the pathologies improve.
As my longtime listeners will know, I typically end the show by asking my guests to share their big takeaways from the show or share their ideas of the biggest myths around fertility and generally advice and guidance for women who are struggling with fertility challenges or otherwise just wanting to improve their health. And so what I'm going to do is I'm just going to run several clips. And these are just tidbits from the show, different things that stood out to me. And so I hope that you enjoy this next segment. And what would you say is the biggest myth about fertility that you would like to see corrected?
That IVF fixes everything.
Mm-hmm.
I said that kind of with my tongue in my cheek. and luckily we're not on video, so I'm kind of smirking to myself. I think if women were given the chance to go to nourish their whole body, their physical with their nutrition, the herbs, and the emotional aspects, and try all of those before jumping into IVF. Because, the medical side of things, there is a need for it. Don't get me wrong. There is massively a need for it, but you need to be in a healthy place. Our reproductive organs close down when we're not healthy. They're the only dispensable organ in our body. So if fertility isn't working, something else isn't right in our body, and it's about looking at getting that sorted first before you do anything else. Because IVF is always going to be much more successful if you've got your nutrition in place and you've got those foundation blocks, because you're going to be healthier.
For instance, with estradiol, there are about or exactly, I can't remember, 12 different estrogens that we produce. Mm-hmm. And estradiol is the most common of those. If we were to collect and distill the blood of 250,000 women, so that's 250,000 women of reproductive age at the peak of their cycle, so at the peak of estrogen production, and we were to distill their blood, this is kind of a fanciful, it's not my ideal world, but it's a fanciful piece of research. If we were to distill their blood and remove the estradiol, what we would find is we would have around about a teaspoon of estradiol.
That's crazy. 250,000 women.
Yeah. It just shows you, and yet as women, we are aware often of the times where, there's a whole lot of things that change in our body when we have peak estrogen compared to less estrogen. For instance, around ovulation, it changes our skin tone, it changes the sparkle in our eyes, it changes how we smell, it changes how our the relative swelling and moisture of our vulva, it changes the viscosity of our blood, and a whole list of other things. And this is from that's relative to our estrogen at other times in our cycle. So we whether we know it or not, we're observing by these things the fluctuations in estrogen. So if we think about that and how powerful estrogen must be in tiny quantities. So if we think of most brands of pill that have estrogen as well as synthetic estrogen as well as synthetic progesterone. So and we're multiplying that estrogen by about 4 times our natural cycle. So it has to have a powerful impact. Now, of course, the idea is that it's switching off our natural fertility, and it does do that. But to think that it's doing that in isolation of all the other things that estrogen does and all the other things that hormones, whether they're natural or synthetic, do, is completely fanciful. Of course, it's going to have an impact right throughout our bodies.
This is my key message, and thank you for giving me an opportunity to spread the word. The most important thing to know is that the mucus is related to fertility. I think if there's one thing that public health nurses and sex educators could say to people when they're giving them a lesson on the menstrual cycle, is what that mucus means. So when you wipe and it feels slippery and it feels slick, and you look at the tissue and there's something on the tissue there that you could finger test and look at, that means that it's a fertile day. And if we could just get that one phrase out there to share with the world, I think that would save a whole lot of grief and a whole lot of indecision and wondering if is it a safe day, is it not a safe day, should I use the morning after pill or not, oh my God, I wonder if I got pregnant. This is one piece of information that I think is so important for us to dispense. So tell all your friends who aren't listening today.
Definitely. And I love that analogy with the fifth vital sign, because I can't remember what all the other ones are either. But there are things that like physicians would use as a diagnostic tool. So you'd look at like the pulse, breathing, I can't remember the rest of them, reflexes, stuff like that. Like just things that are like, are you alive or not? And basic indication of like, if you know, like old school diagnostics would be like, you can check the pulse and be like the heart rate and how fast it is and how vigorous it is tells you a lot of things about the body. I know traditional Chinese medicine uses the pulse a lot for a diagnostic. So yeah, similarly, like there's such a wealth of information, like so many things in the body show up in the menstrual cycle, and somebody who's trained to chart her cycle in this specific way immediately has a lot of knowledge. And then by going to a practitioner who can interpret it, you really get a window into exactly what's going on.
Right. Because estrogen causes copper to be retained, you're not able to mobilize and work with it as well. It's just held into your system, and it'll build up. You can get excess copper buildup because of the effect that estrogen has on copper in the serum and in the tissues. So when you're taking this pill all the time, you're putting estrogen in your system, and it can lead to copper toxicity. And pretty much every woman that I've tested that has very high copper has been on the pill at some point in their life. So if they're not on it currently, they were on it, usually for a number of years. And so that's been, in my experience, it's been more the birth control pill than IUDs that have led to copper toxicity.
How does what a person eats? So as a mom, how does what I eat before I even get pregnant have an impact on my grandkids?
Sure. It's a pretty wild thing. The science of epigenetics has been around for a while, but it's really emerging and becoming more common with the more and more studies that are happening. So depending on what a woman eats and their partner beforehand has the ability to change these switches in our genes. So once thought that we have certain genes, and genes carry certain dispositions to hereditary diseases, etc. They thought these switches, it was like it was on or it was off, and there was no way to change it. But food and the way we treat ourselves nutritionally actually can change those switches to on or off. So now we have the ability to alter how our body and those chromosomes that we pass on to our kids pre-conception and during pregnancy to turn those genes on and off, and it'll read them differently. So how often are you hearing, oh, must have that bad heart from your side of the family, or oh, probably gets that from your side of the family? We don't have to say that anymore. We really don't. We can really take the reins, and we can start preemptively changing that risk factor for our children.
Yeah. Yeah, I mean, I really think what's really dangerous about the medical route is that, you know, the doctors right away are going to give you a list of things that are wrong. And that's really scary. And I think we're taught from, you know, a really young age that to trust the doctors and trust science. And not to say they're not right. And you might have, I was given a whole huge list of things that were wrong with me. And at first, and that was really scary. And I took that to heart. And I thought, well, oh my goodness, all these things are wrong. How could I possibly conceive a baby? And then that became the story. And I was really focused on that. But, you know, changing the story. And I think that's why I started speaking up about my own journey, was so hopefully other women can hear that and say, okay, well, I was also given this bad diagnosis and told my eggs are too old and this is not a high number enough, and, you know, you have this happening to you, and really saying, okay, but I believe in miracles. You know, I don't care what you're saying because I'm going to have a baby, and having that faith and really just trusting your body, listening to your intuition of what needs to happen, and not necessarily letting someone else dictate to you what's possible or what's not possible, is really important.
And what would you say is the biggest myth about fertility that you would like to see corrected?
That's a good question. Well, I don't know that I would call it a myth, but the scuttlebutt is that women these days have a sense that they can be doctors, lawyers, you know, in finance and, you know, corporate CEOs and all of that. So they're working really hard, establishing careers the way that men have always had the freedom to do. And in the process, what gets lost is that fertility has its limits, that we are born with a certain number of eggs, and that we are most fertile the younger we are, and that fertility starts to wane even in the 20s, certainly in the 30s. And while it's not impossible to conceive at or after 40, many of the women that I work with are women who have successful careers, and then it's, oops, I think I need to have a baby before it's too late. And they're struggling with their ovaries kind of sputtering along toward menopause. So I think while it may run contrary to, quote, feminist philosophy, it's also a piece of practical advice to have the awareness that fertility declines, in which case you then have the freedom to do whatever you want. Because these days there have been, since I'm in practice, you know, this is 38 years already, the miracles that are created with assisted reproductive technology are astounding. So the story's not over, but if you want a conception with your own eggs and the good old-fashioned way, then you need to weigh your options.
And that brings us to the end of part 1 of this special anniversary edition. So I hope you've enjoyed the clip so far. Trust me when I say I had the hardest time to narrow it down. Obviously, I didn't really narrow it down because I had to divide the episode into 2 parts. Otherwise, it would have been over 2 hours long. So I really hope that you enjoyed those clips from part 1 of the 100th episode anniversary edition. I'm so excited to share all of these clips with you. And there's so many takeaways from the podcast over the past almost 2 years. It's really hard to put into one episode. So if this is your very first time listening, this podcast episode series, so this 2-part series, will give you such a great idea of the breadth of topics that we talk about on the show, and also just the importance of understanding what's happening with your fertility, with your health, how these things intersect, how they come together, and how your reproductive health is mirroring your overall health, and how they don't happen independently of each other. And so I'd love to hear your thoughts on part 1 of this episode. So please stop by the show notes page, which you'll find at fertilityfriday.com/100. And you'll find a list of all of the clips for both part 1 and part 2. I'm just going to put them all on the same page. So just head over to fertilityfriday.com/100 and you'll see the full list of all of the clips from both episodes there. And so also if you hear a clip and you really want to go back and listen to the full episode, don't worry about remembering the episode name. Just head over there and check out the show notes page. And there's the whole list of all of the episodes that I go through. So I've aired part 1 early on Wednesday of the week. So it's kind of like a bonus midweek episode. And so part 2, I'll be releasing this Friday. So make sure to watch for that. I'd like to thank you for listening to today's episode. If you enjoyed today's show, please share it with a friend. If you've been enjoying the podcast, please do look for it on iTunes and leave a 5-star review so that more people can find it. Also, if this is your first time here, make sure to hit subscribe so that you'll always be notified whenever there's a new episode released. And make sure to head over to fertilityfriday.com and join my email list. If you have an idea for a podcast episode or guest suggestion, send me an email at info@fertilityfriday.com. Thank you to all of you who have emailed me and shared great ideas for podcast episodes, guests to invite on the podcast. I love hearing from you, and that really helps me to make the show relevant to what you actually want to hear more of. So keep them coming. And, thank you so much for hanging out with me today. I do appreciate all of you for taking the time to tune into the podcast, whether you're on the go or commuting to work, walking the dog, doing dishes, whatever you're doing. Thank you for letting me be part of your day. And I will see you on Friday with part 2 of this special anniversary edition. So as always, until next time, be well and happy charting.